I would be remiss if I didn't say thank you to all of you, and especially to John for his leadership. This has been an amazing experience. The training, the opportunity, the networking, it's just been super. Also, I'd like to thank my boss, Jim Graham, the Executive Director at Northwest Community Care Network. Part of the deal is you volunteer your staff 10% of their time, and I'd say Jim's given up a lot more than 10%, but he's been a huge support of this throughout, and so that's been great for me to have that flexibility. And this is a cool experience because listening to Alan, this is sort of my wheelhouse, all this stuff. My day job is I'm the Director of Behavioral Health at one of our 14 community care networks. And so in that role, my job is to help support primary care and other areas of our health system in providing integrated behavioral health to help them with navigating the specialty behavioral health system. And then I also implement that chronic pain initiative across my 7 counties and work on that stuff. So this is sort of a neat event for me because I'm talking about all my stuff. And my project did change a bit. I started out working on a suicide prevention strategy. It didn't work out. There are a number of barriers initially, and this seemed to be a better direction to go. I'm happy to announce, though, that the group that I worked with in Winston-Salem around suicide prevention is now recognized as a national chapter of the National Association for Suicide Prevention. So that's something that just happened recently, and they've been working for years on that. So what I did was I developed this thing, INSIGHT, which stands for Integration Needs Survey for Innovative Growth in Health Treatment. And what it is it's an integrated care practice evaluation and improvement tool. Here are my objectives for this thing. We wanted to be able to assess integration projects from multiple angles. We wanted to capture site data associated with integration projects, measure their progress over time, identify areas of potential growth, and then to link these practices that are attempting to integrate behavioral health to resources so that they can move forward. Because it is not as simple as putting a behavioral health person in the doctor's office and saying, go. It's a very complicated process. So the impetus for this is basically after my initial Bernstein interview, I think during that process I talked some about my interest in integrated care, and Maggie came to Winston-Salem. We met at Starbucks, where all great things start, and she talked to me a little bit about their role with the KBR integrated care program as a technical assistance provider. And so with around 30 sites across the state, the center was charged with providing ongoing technical assistance for those sites. Somebody's trying to call me? There we go. And there were some issues around the evaluation process, specifically that there was no quantitative record for what happened in the technical assistance visits and contacts. There was no indicator of progress over time. The data was not shared back to the practice site, and there was differing content, so it was a standardization issue as well. And if you're thinking from a funder standpoint, KBR wanted to know that they were investing their money for a good reason, that it was moving practices forward, and so this is obviously something that needed to be remedied. So it turns out that Maggie's intent was not for me to immediately create some survey tool, but I took it upon myself to do it anyway. At the time, Beth Glick was here working with the foundation, and she was working on a PhD around integrated care. And so I said, hey Beth, let's work on this thing. And we sat down and we created a survey for sites that were trying to do integration to measure where they were in the process. The initial survey had 150 questions. It is very comprehensive. And then there's a follow-up survey that cuts that in half down to 75. There were open and closed-ended response, so it's not 150 short essays, but it is a very comprehensive survey. And not everybody has to answer all of the questions. It was divided into 3 response groups. So administrative staff answered some of the questions, medical staff answered some of the questions, and then behavioral health staff do. Also, there are 2 versions of this. As was mentioned before, you can integrate in 2 ways. You can bring behavioral health into a medical home, or you can bring medical care into a behavioral health home. So we created 2 versions of the survey that target the different aspects and unique features of each of those models. And then I think the key to all this is it's not just a survey, it's an output. And we created an output in the form of a dashboard so that practices got something back, and KBR as the funder got something back that showed the results of the survey. And this is an example of the dashboard. The integration level up at the top is based on the 5 levels of integration initially created by Doherty, McDaniel, and Baird in '96, and CJ Peak sort of advanced that. There's now also a 6th level that SAMHSA and the National Council is promoting, so we're working with that now. Basically, there is a different version for the medical home and the behavioral health home, and what you get is you notice a lot of color on this example. There's a scale, and so red is sort of needs improvement, green is yeah you're doing awesome, yellow is you're somewhere in between. But we heat mapped the responses so you could immediately pinpoint red means that's where I can work and improve stuff. And then when you get to where you've done multiple surveys, you're also measured not just against the standard with the heat map, but also progress over time. So you see this site is moving from red to orange. They still have a lot of work to do in that area, but you can see progress over time. And then on some of the indices, we also graph it for them so they can see linear progress. The key benefits of using a dashboard is that it shows you your current status versus a goal or a sort of an absolute. It also shows progress over time. It's bite-sized. You know, the concept of integration is so huge. This gave sites the ability to sort of pare it down to the opportunities that were in front of them. And it also really was a great conversation tool for technical assistance because we didn't have to think about integration across the entire spectrum. We could say, okay, let's focus on screening. What can we do about screening? And the other thing is it identifies areas for future focus. So I just wanted to show you the different versions of the dashboard. This would be an initial dashboard for a medical home. This is the initial dashboard for a behavioral health home. And then you see you really get the value when you've done multiple surveys because you can see your movement over time. And you know, you just really want to hone in on the areas that are in the red or pink or orange areas, and that's where you can work. So the current application is that we are using this on a daily basis with all the current KBR grantees and launch sites. It says semi-annual, that's minimum. Many of the sites do it quarterly, some even more than that. And so we've got data on those sites too. It's used as a TA tool to structure on-site discussions. We meet quarterly with all the KBR grantees and we work with the tool to discuss where they can improve. It's also used by KBR to evaluate their applications for expansion. So they ask, what is your current level of integration? Let me see your dashboard. The dashboard has to be included in the application to KBR for expansion. And then the data from surveys is used in our reports back to KBR, and by our, I mean the Center of Excellence. John mentioned I got married during this process, and one of the things that drew me to my wife is early on in our courtship, she told me that she felt very strongly that no human emotion could be expressed any better than through a Will Ferrell quote. So to honor her, to introduce version 2, we were really proud and are still really proud of the first version of the survey and the first version of the dashboard. It's paying dividends on a daily basis. But we also saw great potential for taking it to a next level and multiple levels after that. So we set out to create version 2.0. Not to be crude, but I'd also like to point out that up until we named this thing Insight, it was also being referred to as Peter's tool. So I'm really glad that it now has a name, although there are some that are slow to adopt it. I have been so blessed. I can't say enough about these two women to work with, this amazing team. Beth Nolan is a PhD and works at Pitt, and she's just absolutely incredible, mind that cuts like a knife. And then Jennifer Hodgson, I'm sure many of you are familiar with, is at ECU. Both of them huge experts in community health and integrated care. And so we formed a team to work on this thing. And we also are working with Matthew Sun, who's the founder of Sun Information Systems, who's done other work with the foundation. And he's fantastic. He does huge dollar work for huge dollar organizations, but also likes to do stuff that benefits people and gives us a better rate. So we really appreciate his work, and he's a real professional to work with. The idea behind making this second version web-based is you get increased accessibility and speed. You can save entries in case you need to stop and do something else. We have integrated data entry, so I don't have to enter data into a spreadsheet anymore. We can also provide respondents with immediate feedback. They can fill out the survey online and get a dashboard immediately. It also opens up use to potential users worldwide. Got to thank the supporters. In-kind supports come from Northwest Community Care, University of Pittsburgh, ECU, Sun Information Systems, SAMHSA HRSA Center for Integrated Health Solutions, which is currently operated by the National Council on Behavioral Health, and the North Carolina Foundation for Advanced Health Programs. And then we have also received funding for development from these entities as well. KBR is a notable one there. So the first thing we did was we revised the survey. We renamed it, we created a logo, we created a web interface, and undertook an alpha testing process. Next, we'll be generating a dashboard for the second version, and then linking that dashboard with resources so that when you get your dashboard back, you can click on the areas where you're red, orange, or pink and actually pull up resources that will help guide your entity through the next step. So if you're not doing universal screening for depression and substance abuse, you can click on it and get a webinar on implementing SBIRT and universal depression screening. You know, that's the concept behind it. Then we'll do a nationwide release, which will be supported by SAMHSA HRSA and the National Council on Behavioral Health, and then evaluate that implementation, examine the tool, not only as a practice change practice change agent, thank you, but also policy change. You can see the gaps and you can take that to policymakers and say, this is the real barrier to integrated care, and trust me, we've got lots of them. And then we like to develop new versions that target the behavioral health home, bringing in medical care, and also an implementation readiness survey and dashboard. So we applied a theoretical framework in the development of the second one, the chronic care model, and made sure that we had questions that address every aspect of this. It was really interesting to hear Allison mention things like integrated care being included in the strategic plan, having patient involvement. All those areas are now addressed in the second version. I won't go through the process, but it has been a lengthy process in development. I won't do too much on this, but I did want to show you, if I can get my mouse here, that this thing actually exists. If I was online, it really does exist. Anyway, we own insightforintegration.org.com and .net, which I think is kind of a cool URL. And if it was working, I could click on it and it pops up and I can log in, I can fill out a survey, I can pull down data from all the surveys that have been completed. I can export that to Excel. It's really cool, and it's real. So we're testing the survey, and our team's working on it. The North Carolina Center of Excellence for integrated care TA staff, who are just another amazing group of people. And then the National Council has a number of SAMHSA HRSA supported.
That's us too.
Yes, exactly.
And for everybody here.
Yes, Center of Excellence is a huge part of this organization. The grantees that are supported by SAMHSA HRSA across the U.S. Will be alpha testing the survey and providing feedback. They have nationwide TA support as well, so they'll be able to help us with linking that. And so we want to, provide this dashboard. Like I said, there's now a 6-level framework that we'll link to, and we also want the feedback to these practices to link to online resources so they can move forward and progress. And so this is what it might look like for the second version. So all these areas that are red or pink, they're growth opportunities, and someone might say, okay, well, I'm really interested in looking at how do you bill for screening. So they would click on this, and a number of options for technical assistance support would pop up. They can click on one and it would then open up that resource, and they can start right there at that moment. 5 minutes after finishing the survey, they're off and running in development. So we're going to use a number of the existing resources out there, and it'll also help us to identify areas where there are other resources that we can develop. And one of the other things that we've talked about, I talked about behavioral health home, I talked about practice readiness. We also think this thing has a great opportunity to be used as a grantee management and a technical assistance management tool. Because all that data is in there, we can pair that data with our on-site technical assistance data and see where our technical assistance results in movement and that sort of thing. But there are really a ton of different applications, even up to payer certification, payer recognition certification process, whereby if a site wanted an enhanced payment rate, we could work with payers to say if they achieve level X on this integration assessment tool, then they can qualify for some sort of enhanced payment or something else. So that's it. I know that was rushed, but we're really excited about this thing and think it has huge implications for integrated care. And North Carolina, like Alan said, is widely regarded as a leader in integrated care, and this foundation has a lot to do with that. So.